Hi, if you're dealing with a chronic head or neck issue, there may be a solution for you. Hi, I'm Dr. James Leonette from Enliven Chiropractic in Bridgeport, West Virginia. What we need to look at when you have a chronic head or neck issue is a very specific joint at the top of the neck where it meets the cranium. It's called the cervicocranial junction. If we look over here on the map, it's going to be this region right here. It's going to be this top vertebra known as C1 or atlas. And we look at that in a very mechanical way. We look at it in relation to the head and then the lower part of the neck. That's important. Your head weighs about the same as a bowling ball. Now I have a shot put that's about 8 pounds. And a bowling ball, your head's gonna weigh about 12 pounds. And you can just hear, if this thing is misaligned, it causes significant issues. So what we wanna do is make sure that this sits at a perfect 90-degree angle so that the brain and the brainstem that are up in this way can drop straight down and have no interference. When there is that strong misalignment, a lot of postural changes show up as evidence that we have a significant misalignment. You'll see here where you'll see shoulders go up, you'll see the hips shift a little bit. If you pay attention as you walk around the mall or the store, you will rarely see somebody walking around like this with their head tilt because there's a riding reflex, so your eyes will be level. But if you pay attention, you're gonna notice a lot of people have a drop shoulder or a higher shoulder. And that's a neurologic condition because the head isn't basically sitting on the body straight, and you have these inappropriate nerve signals going down and causing muscles to twitch up and to stay straight or to stay flexed so that the eyes can be level. So one of the key ways that we look at this is we don't do any guesswork and we don't like a lot of force when we make this correction. So with this, if you're a good candidate, we'll take several images and with our X-ray analysis software, we'll figure out the exact misalignment pattern. With that, I'll bring you over here and I'm going to show you on the instrument over here. Going for any treatment can be scary, especially when it's something new or it's a new field. A lot of people that come to us have never been to a chiropractor before. Now we look at your body systems much like a medical doctor, but in a more holistic sense. But to take some of the fear out, let's go over this technique. And this may be one of the scariest looking machines out there, but the reality is it actually delivers one of the most gentle adjustments that can be there. And when we talk about an adjustment, it's a very gentle nudge to allow that vertebra to go right back into its normal place. So with this, there's a lot of factors that go in from the x-rays. There's some head piece height, there's some shoulder motion with this. But with this instrument, basically you're gonna lay on your side. You're gonna be facing with your right side up or your left side up. We're gonna use this big metal device here. Now up here is a hammer. The hammer hits this metal pole and it delivers a wave force going down through that translates over into that first vertebra. So I want you to look here and I'm gonna hit this and you're gonna notice this does not move. It does make a loud sound, but that's it. I'll hit it one more time. See it, this does not move at all. So that's a way we can deliver a very specific, controlled adjustment to realign this top vertebra. The fun thing with this technique is we can verify the results. There's a series of tests that we will do to confirm that it got aligned up in the right way. There's also post-film x-rays, so we can do a couple of the studies that we did to initially start your care so that we know where the misalignment is. And we can verify that it got back into a orthogonal or 90-degree alignment. And that's a great way to show that there is a correction that has been delivered and that your body is back into a state of healing. So if you have questions about the upper cervical atlas orthogonal, or you're looking for a second opinion on a neck or head condition, please give me a call. Again, my name is Dr. James Leonette at Enliven Chiropractic at 304-933-9355.